Okay, let's continue to study about the facial cranium. There are 15 the facial cranium. First, let's see the maxilla. The maxilla is a paired bone. You see here is the left maxilla, here the right maxilla. And now you see this picture is the right maxillar lateral aspect on the right side to see it. And this one is the medial aspect to see the right maxillar. And every maxillar has one body, 4 processes from the body, and in the maxillar there is a bone, there is a sinus in it. First, let's see one body. Nothing in the center. In the center is the body of it. And from the center, from the body, go outside, there are 4 processes. The first one is frontal process. The frontal process go upwards, connect with the frontal bone. You see this part. And second one is zygomatic process. Will go laterally, connect with zygomatic bone. Third one is alveolar process. The alveolar process go downwards, this border, and these processes connect with the upper teeth or the upper teeth. The fourth one is palatine process. The palatine process, you see, this picture is the medial view, the medial aspect of the maxillar. You see this aspect. And the green one is maxillar. You see the right one. The right bone is, yes, palatine bone. Yes, that's now we see palatine bone. And so this process is palatine process. Now you see here, this part and the palatine bone, they will form the upper palate. Upper palate is the roof of your oral cavity. The roof of your oral cavity. Okay, it's about maxillar. This bone is in the center of your face and connect many bones, upper to front bone, lateral zygomatic bone, lower upper teeth, backward to palatine bone. And on the body there is a foramen. This foramen is infraorbital foramen because this foramen is behind the inferior border of the orbital. And in this foramen there is the infraorbital nerve, artery, and vein go out from here. In here, infraorbital foramen. Okay, now let's see the second bone, mandibule, or the mandible. The mandible is a very big bone and it's a very important bone for us because many bones in the skull can't move, but this bone always move because there is very important joint is temporomandibular joint. Okay, now let's see structure on this bone. First, this arch, this big front arch is the body of it. From this body, there are 2 reamers go upwards and backwards. This one is the reamers of mandibule. And between them, between the base of the body and the posterior border of the reamers, there is the angle of mandible. You can touch all the inferior border and the posterior border and the angle of the mandible on your body, on the surface. And on the lateral side, lateral surface of the reamers, there is mesenteric tuberosity. Tuberosity, what's tuberosity? Tuberosity means on the surface of the bone, there are many not smooth surface, many small processes on it. It's tuberosity. The tuberosity is the insertion of some muscle. There is a muscle is mesenteric muscle, mesenteris. This muscle from temporal bone, then go downwards and to here. This muscle, the mesenteric muscle. When this muscle contracts, go upwards, will make your mandible move downwards. Okay, this part upwards, this part will go downwards. Okay. Now, let's continue. Here is the body of the mandible. The body of the mandible. Here is the mental protuberance. Mental protuberance is a big, precise. Go forwards. And on the lateral side of the body, there is a mental foramen. Mental foramen. See here? And there is a nerve go out from here. It's a mental nerve. It belongs to the inferior mandibular nerve. Here's the angle. And there is oblique line. It's the anterior border of the remius, oblique line, and the superior border of the body. And you see here is the back of the body, the medial surface of the body. You see here is the mental spinatus. There's a muscle connect on it. Okay, now you see on the top of the remius, there are two processes. The posterior process is hyoid of mandible. This hyoid will connect with temporal bone from temporal mandibular joint. And the lower part is a narrow part. This part is the neck. And anterior process, this one with conoid process. Conoid process. On the surface on the hyoid is condylar process. It's a very smooth surface, articular surface. And between the two processes there is a notch. The notch is mandibular notch. Oh, here is wrong. There's deleted R, notch. Okay. And on the medial surface of the remius, there is a mandibular foramen. Now you see the foramen. Here is the mandibular foramen. And the mandibular nerve will enter to it, and then go inside the remius and inside of the body, and finally we go out from here. Yes. Here is the mental foramen go out. There is the mandibular nerve, and then this nerve distributed around the mandible, anterior surface of the mandible. Okay. And on the medial surface, there is another tuberosity. This one is pterygoid tuberosity, because there is a muscle on the medial surface. This one is pterygoid muscle. Pterygoid muscle. Okay, now let's see the third bone, zygomatic bone. This bone, you only know the location. It's on the lateral side of the face and connect with many bones. Upper side connect front bone, forward connect maxillar, go backward to connect with the temporal bone. Okay, it's a connection of it. The fourth one is nasal bone, very easy, on the superior part of your nose. The fifth one is lacrimal bone on the medial wall of your orbital. It's the right orbital, the medial wall, left orbital, the right wall, the medial wall. The sixth one, palatine bone. Just now we have seen the palatine bone is behind all the maxillar, and the shape, this picture is the inferior view of the palatine bone behind all the maxillar. And this bone is the English letter L shape. Now you see this one is anterior view. This one is the left laminal palatine bone, and on the right side there is another palatine bone. Okay, and between them here should be the vomer. This one, the vomer, the left palatine bone, right palatine bone, and this one is horizontal plate. Horizontal plate. You see in here, left and right, and here is vertical plate. Vertical plate is on the lateral side, on the lateral wall, and affirm the lateral wall of the nasal cavity should be here. Yes, here is the vertical plate. Okay, and this picture is a medial view. You only see this surface, this wall. You see the medial surface of it on this picture. Okay, now let's see the software. Let's see again. Here, palatine bone. You see? Why so slow? Okay. Okay, palatine. Now let's see it on another side. Maxillary hyoid. You see it clear? Where? Here. This one. Left palatine. You see this one is vertical plate of left palatine. Here is horizontal plate. And this side is right palatine bone, vertical plate and horizontal plate. The lateral vertical plate will form the lateral wall of the nasal cavity, one part, and horizontal plate will form one part of the upper palate, the roof of your oral cavity. Okay, now let's see the next one. The seventh is inferior nasal concha here, inferior nasal concha, and from here you see this wall is the lateral wall of right nasal cavity, the lateral wall, and here inferior nasal concha, here middle nasal concha, here superior nasal concha, but superior and the middle nasal concha they belong to ethmoid bone. Yes, they belong to ethmoid bone. You know the ethmoid bone has horizontal plate, vertical plate, and the two lateral side is the labyrinth, ethmoid labyrinth. Okay, and here is the inferior nasal concha connected with the lateral wall, but it's a bone. Yes, it's one bone. You see here is the palatine bone, horizontal plate, vertical plate. Eighth, vomer. Here, the pink is the vomer. On this picture here is the vomer. You see the vomer will form one part of middle septum of the nasal cavity. Now let's see the software. Vomer. Where is the vomer? Here. Here is the vomer. Now let's see. This is C on the inferior view. Now let's see on the anterior view the vomer in the middle of the nasal cavity and form one part of the nasal cavity, middle septum of nasal cavity. Anterior part is the vertical plate of ethmoid bone. The posterior part is the vomer. The ninth one is hyoid bone. This bone is under your mouth, and connect with your tongue, by the tendon and the muscle, And every hyoid bone have one body and two cornea. One is small cornea. This one is the corneal minor, go upwards. Another one here. Another one will go backwards. Is a long cornea. Is a corneal major. Go backwards. Okay. Here is a hyoid. And in your surface, please touch your neck. And first you can touch your larynx. And You can touch the base of your mandible. The base of your mandible. Here is the pharynx, and between them should be our hyoid bone. Hyoid bone. Okay, it's about facial cranial.